When it comes to injecting your fertility medications, there are two main types of injections: subcutaneous, which is under the skin, and intramuscular, which is into the muscle. So let's take a look at some common ways you'll see and administer your fertility medications. You always want to swab the area you're injecting with alcohol, but here's the thing that everyone does. They swab the area with alcohol and then they blow or wave to help it dry. That defeats the whole purpose. You're just reintroducing bacteria to that area. So you want to swab with alcohol, let it dry on its own. You also want to make sure that you're swabbing the lid of any vials before a needle goes into it. That just helps maintain sterility and avoid any sort of unwanted contamination and reduces your risk of infection. Be sure to rotate your injection sites. If you inject into the same exact area over and over and over, it's going to break down the skin and cause a lot of discomfort. So you can switch back and forth. You can go from your stomach to your thigh and back, but changing up where you're injecting will really help minimize discomfort. The first form I want to go over is the subcutaneous pen. This is common with the stimulation medications, and it either comes pre-filled or with a vial that you put into the pen itself, and they're really user-friendly. You dial up your dose in the window according to the provider's instructions. Some pens come with the needle already attached, and others you attach the needle yourself. Always use a new needle every time. These go directly into your skin at a 90-degree angle, and then you press down on the plunger, and it's just that easy. Now, keep in mind that a lot of times these are multi-dose pens, so you don't want to throw the pen away after one dose. You put the cap on, remove the needle, get rid of the needle in a sharps container, and save the pen for your next dose. Subcutaneous injections can also come in a pre-filled syringe, and these are even simpler. You just remove the cap, insert them into the skin at a 45-degree angle, and gently press down, and you're done. And most of the time, pre-filled syringes just contain one dose of medication, so you can get rid of them in your sharps container once you've injected them. The third and a little bit more complex form of subcutaneous injection is the vial that you need to mix or reconstitute. You'll have a vial of liquid and a vial of powder, and you have to basically withdraw the liquid and inject it into the powder to mix up your medication. Then you have to withdraw the dose and inject it. This can feel a little complicated at first, but once you get the hang of it, it's not that hard. You want to swipe the top of each vial with alcohol and let it dry. Attach a fresh needle to your syringe. Most of the time, I recommend pulling back a little bit on the syringe, depending on how much liquid you're going to draw up. That's just going to make it a little bit easier for you. Place the needle at a 45-degree angle, press straight down, and you notice I have one hand on the syringe and one hand on the vial, and then I'm gonna flip the whole thing over. This gives me full control so the needle's not wiggling around, and I can use the other hand to pay attention to where the liquid is on the syringe so I know exactly how much to pull out. Once you reach the right dose, flick it a little bit to get the bubbles to the top, push up to remove any air from the liquid, and then you're gonna use the exact same movement to inject that liquid into the vial of powder. Nice and slow. Don't go crazy. If you press too hard, you're just gonna create foam and bubbles, and you're gonna have to wait for that to settle down. Now, this is often a step that people they wanna shake or swirl. You can gently swirl, you should not shake. Again, that's just gonna create bubbles and foam that you're gonna have to wait to settle before you can withdraw your dose. But it's just that easy. You've mixed your dose, and then typically you'll wanna use a fresh needle. You have your mixed liquid, it's ready to go, same thing. You'll draw out your dose, and now it's ready to inject. Same way. You're gonna do it at a 45-degree angle, nice gentle pressure. But don't worry, your fertility team is gonna go over this in detail and make sure that you understand exactly how to mix the medication before they send you home with it. You can use an ice pack. If you're really sensitive or having a lot of pain, place an ice pack on the area of your skin that you're going to inject into. It helps numb the area a little bit and makes injections a little bit less uncomfortable. You can also put ice on the area afterwards, especially if you happen to hit a tiny blood vessel and have a little bit of bruising. That can just help shrink the blood vessel and minimize any bleeding in the area. The final form of injection when we're talking about fertility medications is the intramuscular injection. Intramuscular injections use larger needles so they can be a little bit more painful. And the most common intramuscular injection is gonna be progesterone in oil. So it's a lot thicker than the other medications, and a lot of times when you're injecting progesterone, you're gonna wanna switch needles. And that's because each needle has what's called a gauge. That's how big around the hollow section of the tube is. The higher the number, the tinier the inside of the needle. For oil, we want a low number and a really wide needle. That makes it easier to draw up that oil. But then we want to switch to a little bit smaller of a needle so that it's less painful to inject, because I'm sure you can imagine the bigger the needle is, the more pain you're going to have putting it in. You'll draw out your dose, and you can see it's a thick oil, so it can take some time to pull it into your syringe. Now, you've measured your dose, and your dose includes what's in the needle typically. So before you switch needles, you're gonna wanna pull back until you see some air in the syringe that pulls back any progesterone that was in the needle. You're gonna wanna scoop the cap up, try not to touch it, that avoids any unintentional needle sticks, and twist on your new syringe, or your new needle. Now you'll notice at no point am I setting the syringe down without a needle on it. That's because we want to keep that end as clean and unexposed to contamination as possible. So you want to have your new needle ready to go and minimize the amount of time there isn't a needle on here. Once you've switched your needle, you're going to press up to remove that air, and you'll see a little bead of oil at the top, and then you know you're ready to go. Now, an intramuscular injection is at a 90-degree angle, and you want to use a dart-like motion. It's a larger needle, so you don't need to go crazy, but the slower you go, the more painful it's likely to be. So I usually recommend bracing your hand and just doing 1, 2, 3, and then press down. Now again, because progesterone is an oil, it's gonna take time to inject it, so just use nice steady pressure and be patient. Until it's empty, pull it out, and into the sharps container you go. The last thing that I think is really helpful to know is that the progesterone in oil is a special beast. It's an oil and it's thicker. So while you use ice with a lot of other injections, you don't want to use ice with progesterone. It's thinner and more comfortable if it's warm. Now that doesn't mean you should put it in the microwave, but it does mean you can roll it gently between your hands and use your body heat to sort of warm up the oil a little bit before you inject it. It's also really helpful if you put a heating pad on the area you're going to inject to warm up the skin. That helps ensure that when you inject the oil, it stays nice and thin and warm, and it makes the injection more comfortable. And that's the only injection that I would recommend using heat on to help make the injection more comfortable. If you aren't sure how to mix or inject your medications, stop and ask for help. You can reach out to your fertility clinic or the pharmacy that's filling your medications. I worked as a fertility pharmacist for a number of years, and I can't tell you when I was on call how many people got home, thought they knew what they were doing, and realized all of a sudden they were completely overwhelmed. That's what I was there for, to walk them through step by step and help them understand exactly what to do to inject their medication properly. It's always better to be safe than sorry.